I'm Dr. Briend. I'm a medical doctor, and I've been working doing research on child malnutrition for many, many years. When I was in Bangladesh, I did research on the association between malnutrition and mortality. There must be something like 17 or 19 million of children who suffer from acute malnutrition. The real number, we don't know exactly how many there are, big number. At that time, WHO recommended to treat the children within the hospital with a liquid-based diet, which limited the capacity for treatment. Treating a child in hospital is always very expensive because you need a facility. It's expensive for the health system, but as well it's very expensive for the family. My contribution was, first I found that children who are going to die from malnutrition can be easily identified by measuring their mid-upper arm circumference with a simple tape. And also to develop, in collaboration with a colleague from the food industry, Michel Lescan, to develop a diet which had a similar nutritional property, but which could be consumed without the addition of water. The dangerous part of the traditional diets was the mixing of food and water, because food and water provide an excellent growth media for bacteria. If you eat them separately, if you eat the food without the addition of water, and the water is taken later, you considerably decrease the risk of accidental contamination, and then this part of the treatment can be safely carried out at the household level, at the community. And this led to the possibility of massively increasing the number of children which could be treated. The Gairdner Award is very important for me and for all people working in the same field, because it draws attention on the possibility of treating children with severe acute malnutrition easily at the community level. I think this is very important to stress. And also I think it's very important for all my colleagues and all those that I don't know who work on the same topic. I think also it's a big encouragement for them, and I highly welcome this. There are very important work going on, and I think the Gairdner Award is an encouragement for all the people involved in this research to continue further.